Welcome to Dr. Balaga's podcast for the Curious Doc. Today is August 8, 2026. This video is on a New England Journal of Medicine review article titled Syncope, published 3 days ago on August 5th, 2026. What is syncope? It's a transient loss of consciousness due to temporary cerebral hypoperfusion with rapid spontaneous recovery. How long does syncope usually last? Typically less than a minute. What are the three major causes of syncope? Reflex syncope, orthostatic hypotension, and cardiac causes. Why is syncope important in older adults? It may present as unexplained falls and carries a higher injury risk. How common is syncope? It affects 1/3 to one half of the people during their lifetime. What is reflex syncope? Autonomic dysregulation causing vasodilatation, bradycardia, or both. What is vasovagal syncope? The commonest reflex syncope caused by hypotension, bradycardia, or both. What is situational syncope? Reflex syncope triggered by actions such as micturition, swallowing, coughing, or emotion. What is carotid sinus syndrome? It's a reflex syncope from carotid sinus hypersensitivity, mainly in older adults. What is orthostatic hypotension? A fall in systolic blood pressure equal to or greater than 20 millimeters of mercury, or diastolic blood pressure equal to or greater than 10 millimeters of mercury on standing. What causes cardiac syncope? Cardiac arrhythmias, structural heart disease, and impaired cardiac output, like in aortic stenosis. What is the final step in evaluation? Detailed history, witness account, clinical exam, orthostatic blood pressure, and ECG. What features suggest cardiac syncope? Exertional or supine syncope, structural heart disease, abnormal ECG or family history. Can urinary incontinence occur with syncope? Yes. It does not reliably distinguish syncope from epilepsy. Which tests are guided by clinical suspicion? ECG monitoring, echocardiography, blood tests, tilt table testing, carotid massage, and ambulatory monitoring. When is tilt table testing useful? When reflex syncope is suspected but not confirmed. When is carotid sinus massage indicated? In patients above the age of 40 years with suspected reflex syncope or unexplained falls, who should be hospitalized? Patients with high-risk features or serious underlying conditions. How is reflex or orthostatic syncope treated? Hydration, avoidance of triggers, medication review, and selected drug therapy. When is pacing indicated? In selected patients with documented bradycardia-related reflex syncope or carotid sinus syndrome. What drugs may worsen syncope? Antihypertensives, diuretics, psychotropics, opioids, and anticholinergics. What drugs can treat orthostatic hypotension? Midodrine or droxidopa. Others have less robust evidence. When is an implantable loop recorder? What is an implantable loop recorder? It's a long-term monitor that correlates rhythm with symptoms. What mimics syncope? Epilepsy, hypoglycemia, psychogenic pseudosyncope, TIA, cataplexy, intoxication, and others. What is a key management principle? Treat the underlying mechanism while reducing recurrence and injury risk. This is an infographic on this topic. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.